So welcome everybody. Today we are going to be listening to Dr. Katie Huffling, who's the Executive Director of the Alliance of Nurses for a Healthy Environment. We are partnering the Mid-Atlantic Center for Children's Health and the Environment, of which I'm co-director. Dr. Ruth McDermott Levy is the other co-director. We will be co-hosting this event today. And we're going to be talking today about indoor air quality and COVID and nursing's important role as we continue to look at some wild recommendations by some politicians, and keeping in mind that nursing's voice is the most respected voice, and how we might use that in trying to protect school children. So I'm going to just ask Katie to take it away.
Great. Thank you, Dr. Anderko, and so glad to see all of you here today. Just a quick bit of housekeeping. We are able to offer 1 hour of free continuing education credits for today's program. You'll be receiving an email after this webinar with a link to the recording, as well as a link to a post-test and evaluation. In order to receive the 1 hour of continuing education credit, you must complete the post-test and evaluation. And it can take a couple days for the response and the certificate to come back. So if it takes a couple days, don't worry. We just have to manually okay all of the tests. And please pop any questions that you might have for me or Dr. Anderko in the chat, and we'll have time after the presentation and brief discussion between the two of us for questions from all of you. So hopefully we can have a nice discussion. So let me share my screen here. Are you seeing the full screen version?
Yes.
Okay, great. There we go. So today we'll be talking about indoor air quality in schools and how nurses can make a positive difference. And, you know, I think not just in our K through 12 schools, but also, you know, there's lots of opportunities in daycare settings, college settings where especially right now with COVID, that, you know, indoor air quality, we're really, I think it's coming to the forefront with how important it is to the health of the students, faculty, and those working in schools, both for productivity, but also so that they can do well and succeed in their schooling. So today we'll be talking about different air quality issues that are commonly found in schools. Some of the issues with disinfectants, you know, I think with COVID, the use of disinfectants has increased exponentially. And so we just need to be aware of some of the issues related to that, and how nurses can work together with other folks in their schools, you know, interdisciplinary collaboration. Working together, we can really make a positive difference. This week, we're holding this webinar because it's Children's Environmental Health Week. The official day is on Thursday. There's tons of activities going on. If you go to cehday.org, you can find other activities. They're going to be having like tweet storms and different webinars, and the Children's Environmental Health Network is also having tons of fun activities, like things like group yoga virtually and stuff. So if you have kiddos at home, it's a fun way to connect with other parents and kids that are interested in environmental health. And I just wanted to say thank you to the Mid-Atlantic Center for Children's Health and the Environment. They're part of the Pediatric Environmental Health Specialty Units. There's one in each EPA region. So no matter where you are in the country, there's a PACU that can help you. They're an amazing resource that I don't think enough nurses and other health professionals and just the general public know about anything related to environmental health in children or pregnant women, breastfeeding women. They can answer questions, they can provide consultation, and they have tons of free resources. So please check them out at pesu.net. And like I said, they're just an amazing resource that I feel like don't get enough credit. So just to start out, what is the state of our schools now? Like, what are some of the issues that we're facing? As many of you probably know, our schools can get crowded. They may not have appropriate upkeep due to funding restrictions. I just thought this statistic was amazing, that our average school has an occupant density similar to prisons and airplanes, so we've got lots of people in small places. And, a lot of areas in our country, we just haven't had the funding to adequately keep up our schools. Many of the schools are older, they're costly to maintain and modernize. And it's really expensive to build a whole new school. And so, unfortunately, a lot of our kids are going to school in schools that aren't having proper maintenance done on them, or may not have things that will help them to be healthier in school and to succeed in school. And so just a reminder for folks to make sure that you're on mute. And so this, significantly can impact both the health of the students, faculty, staff. It can impact school performance and attendance. You may have more kids that aren't coming into school because of health issues. And they also have found that schools that have better maintenance have improved school performance, which I don't think is an unexpected finding. I know I live in the Washington, D.C. area, and when I first moved here, there was a lot of discussion, and I'd say some controversy around the state of some of the schools here in DC. And I remember thinking how
I didn't keep track of each individual one.
There we go. I just remember thinking how it's really hard for students to do their best when we're not showing them that they're worth putting their best into it. When they're having to go to school in a school where, the tiles coming off the bathroom walls or the paint's peeling, it's not showing the students that we think that they're capable of being the best that they can be. And so I really, that's an area that I feel strongly about, that by maintaining our schools, we can definitely, besides the health impacts, just mentally help our kids reach their full potential. And this is from an example for the indoor air quality program by the EPA that we'll be talking about in their tools for schools. But they also found that in their analysis that schools that were well maintained had better student attendance and lower annual dropout rates. So, it's just a win-win-win when we're able to improve maintenance in our schools and improve indoor air quality. So what are some of the things that we find if we aren't addressing indoor air quality problems? There's an increased potential for both long and short-term health problems, both in students and staff. As stated, it can negatively impact student performance, but also attendance and their comfort in the classroom. It also impacts teachers and staff comfort and performance. And right now, it's really tough out there for teachers, and we really want to make sure that our quality teachers are staying in schools. It accelerates deterioration and reduces efficiency of school facilities and equipments. It can increase the potential for school closings or relocation of occupants. It can strain relationships among the school administration, parents, and staff. I mean, I've seen that here in DC. Why aren't our schools being taken care of? And especially in areas that are lower income or maybe communities of colors, there's a lot of issues around historic systemic racism that can come up when our schools aren't being well maintained. It can do things like create negative publicity and can create liability problems. Schools don't want to be making kids sick. And if we have poor indoor air quality, there can definitely be a link between things like asthma, other respiratory health issues, and indoor air quality in the schools. And so as we're looking at indoor air quality and we're trying to think of how we can address these, it's important to know what factors are creating issues around indoor air quality. And so some of these that may be assessed are things like, what are the sources of indoor air pollutants? How is the heating, ventilation, and air conditioning or HVAC systems, like how are those functioning? How old are they? Who's in the building? How many students do you have? How many staff? And faculty? What are the age of the students? And then what are some of the pollutant pathways? How are they getting into the building, out of the building? Those are just some of the things that we can be looking at as we're looking at indoor air quality. And, a big focus right now on indoor air quality is related to COVID-19. And, some of the specifics have been changing over the past year and a half, but I think a lot of the broader knowledge really hasn't changed. We know that kids under the age of 10 can transmit COVID-19, that kids that are a little bit older, middle school, high school age, are at greater risk of getting COVID-19. One thing that's good news around the Delta variant, though we have an increased number of cases, it's a much more virulent form of COVID-19. We're not seeing an increased severity. So if you're looking at severe disease or hospitalization in children, it's the same levels. It's just we have so many more cases that you're seeing more kids with severe or disease or hospitalization. And, I think it's important as school nurses that we be looking at what's going on locally and be able to use appropriate prevention strategies based on the COVID levels that are happening in your community. And so here's a question for all of you. What is the main mode of COVID-19 transmission? So what should we really be thinking about? If you could monitor that, Laura, because I can't see the chat if folks are chatting in. Well, I know a lot of us were looking at lots of disinfecting early on in COVID, but what we're really finding is that it's really aerosols that are the main source of COVID-19 transmission. So it's primarily transmitted by droplets and tiny aerosols. And these are emitted when we're breathing, talking, yelling, singing. So, especially in like an elementary school classroom, that there is lots of opportunity for transmission. The really small aerosols can travel long distances indoors and can remain suspended in the air for hours. And so with the emergence of the new Delta variant, top aerosol experts are urging schools more than ever to improve ventilation and filtration to reduce the viral loads indoors as part of their mitigation efforts around COVID-19. And I just want to reiterate that while cleaning surfaces shouldn't be ignored, we need to be putting most of our efforts into cleaning the air. It's also a win for cleaning out other indoor air pollutants that could have negative health impacts. So I think it's a win-win-win for everyone. And I just thought this graphic was really great at showing kind of what they're finding out about how COVID, the SARS-CoV-2 virus can stay in the air. So, if you think about somebody smoking a cigarette and how they, they breathe out the smoke. And so you get that like initial puff of smoke and it comes out, kind of more concentrated in the, close area. So if you were talking to somebody who's smoking, you would get that concentrated bit of smoke, but then it kind of starts to fill up the room, and you start to be able to smell smoke across the room. In a similar way, the aerosols from just breathing and talking and coughing, that you can get that same bit of aerosols that have COVID-19 in them throughout a room. And so really looking at how we can quickly be recycling the air, filtering the air to get those aerosols out of the room is a really important component of reducing the risk of COVID-19 transmission in classrooms.
You just saw cows being milked in the parlor. Some of that.
And now that we're starting to get into the winter months, where there's definitely more of a concern because we've got the windows closed, everyone's inside. With the dry air from heating, the virus can travel even further, and you have to worry more about the indoor ventilation. And so this is just an example from the EPA of kind of what the HVAC systems of a typical school would look like. Some of their recommendations are to use natural ventilation, opening windows if possible, and if it's safe to do so. But a lot of schools nowadays, you can't open the windows or they're painted shut. So you're kind of stuck not being able to open the windows, unfortunately. Or if you're in an area, we've had all these wildfires this year. You obviously don't want to be opening the windows if you're getting smoke from the wildfires. They're asking the HVAC folks to increase the percentage of outdoor air coming in and increasing total airflow. So you're getting more recirculation of air. Also changing out the filters. This can be challenging for some older systems, or depending on what type of HVAC systems to use these, more effective filtration systems. It can put more of a tax on those HVAC systems, which can be a challenge. And they also recommend running the HVAC systems at their maximum outside airflow for 2 hours before and after the spaces would be occupied during the school day. And just to give you a couple of examples of some of the challenges facing schools, my organization put out this report in January called Nurses on the Front Lines, Unmasking the Influence of Air Pollution, Health Disparities, and Oil and Gas Development on COVID-19. And we were looking at 3 different states, Colorado, Montana, and New Mexico. And we interviewed nurses in those 3 states. And this nurse here in Colorado, Darcy Martinez, she was working the summer before temporarily as a school nurse. And at the time they were just trying to get things ready for the kids to come back to school. They hadn't been in school all spring. And based on the recommendations from the CDC, they were wanting to do those things that I was just talking about, increasing filtration, having more outside air coming in. And this school happens to be located next to the largest oil refinery in Colorado. And the HVAC system folks were like, we can't increase that airflow coming inside because the air outside has such high levels of particulate matter and other air pollutants that if they were to do that, that the kids would be getting too high of a load of some of those air pollutants. And so, in a similar fashion, folks that are in areas with wildfires, the air outside is it's full of particulate matter. And so how do you, bring more of that? You don't want to be bringing more of that bad air inside. So it's a really tough situation for these schools on how to, follow the CDC recommendations for airflow related to COVID-19 when you have these outside air pollution stressors happening. But luckily, we've got nurses in schools. We could use some more nurses in schools too. But I think there's lots of opportunities for nurses to be real leaders and working with folks within their school systems to make the air safer for everyone in the school. This is a great tool from the EPA, the Indoor Air Quality Tools for Schools approach. They have a framework for success, and they've broken it up into 6 key drivers that they found are essential elements of effective and enduring indoor air quality management programs. And so what they're saying is you should be applying a continuous assessment, planning, action, and evaluation of these 6 drivers in order to make sure that you're effectively implementing an indoor air quality management program and making sure that it's successful. So the 6 areas are: organize for success, communicate with everyone all the time. So thinking about who within the school needs to know about the indoor air quality program. Assess your environments continuously. Plan your short and long-term activities. And, as nurses, we're really good at planning things out. So being a part of that team, I think, can be a really great part of nurse leadership. You need to act to address structural, institutional, and behavioral issues that may be blocking a successful indoor air quality program.
Katie, we can't hear you.
Am I back?
Yes, you are.
How long was I muted?
Just,
I don't know
just
what happened.
a few seconds.
Okay.
You're good on the slide. Yeah.
It was me. I'm sorry. I tried to mute everyone.
So we have and so they now have a mobile app, which is amazing. Makes it even easier to access all of the resources and tools that the EPA has developed. And what's wonderful about this, it's free. And they've, if you have any issues or questions, they have the resources and they have the staff that you can ask questions if needed. It's such a great resource. And so I highly recommend, if you're interested in addressing indoor air quality, taking a look at this program. The Harvard School of Public Health has also developed some tools, and these were particularly related to COVID-19, and really great step-by-step guides on how to evaluate for ventilation in classrooms, how you can address this, and providing lots of resources. And so this is a 5-step guide. And so how they say to do this is you measure the classroom dimensions, perform preliminary audio and visual checks, you measure or estimate outdoor ventilation rate, and they have different ways to do that. And one of the ways that they recommend is there's these inexpensive CO2 monitors that you can use. And then they have like target ranges that you're trying to meet. And then if you're not meeting those targets, then figuring out, they have some different recommendations on how you can supplement what's currently happening in that classroom. And it can be a bit of a challenge in schools because you think about it, the number of kids can change drastically in each classroom over the course of the day. The ages of the kids can change drastically. So it can make it a real challenge to make sure that you're getting the proper ventilation so that the aerosols aren't building up to a significant amount. The National Association of School Nurses has a really awesome COVID-19 reference online where you can find out the latest recommendations around air quality, around personal protective equipment. So I highly recommend, if you're needing more COVID-19 resources, checking this out if you haven't already. I'd say even prior to COVID-19, I think that there was a movement towards more disinfection in the classroom. A lot of classrooms, when you get your list of things your child needs to bring into school for the year, they may have on that list, Lysol wipes or some of these different things that are disinfecting. And really, for most things, we just need soap and water. And so, I think it's important to distinguish between cleaning and disinfecting. And cleaning refers to the removal of germs, dirt, or impurities from surfaces. Cleaning does not kill germs, but it removes them and lowers their numbers and the risk of spreading infection. And disinfecting refers to using chemicals to kill germs on the surface. But disinfecting doesn't necessarily clean dirty surfaces or remove germs. So most of the time you need to clean first and then disinfect. And disinfectants are actually registered as pesticides because they are killing organisms. Disinfectants can be associated with a wide variety of health impacts, and this includes skin irritation and burns, eye irritation, respiratory tract irritation, including asthma and breathing difficulties. And, you really have to follow the manufacturer's instructions about using them. If there's any special equipment like gloves that need to be used, if they need to be mixed a certain way. And also many disinfectants, in order to actually work, they have to sit on the surface that you're disinfecting and stay wet for a certain amount of time. Usually it's like 5 to 10 minutes. And so, how often are we, when we're cleaning, having something like that just sitting on the surface? And also I know from speaking with nurses in healthcare institutions that some of these disinfectants, they can actually degrade certain, especially some plastics over time. And so being really careful about what you're using on different objects in the classroom, because disinfectants could make them degrade much more quickly than they otherwise would have. These are a few different resources. If you do need to disinfect, the Safer Choice is part of the EPA pollution prevention program. And so this program, I'm sorry, I have a work person here up above me. I don't know if you can hear, the pollution prevention program includes practices that reduce, eliminate, or prevent pollution at its source, such as using safer ingredients and products. And they now have more than 2,000 products on this list that carry the Safer Choice label. And Safer Choice products are available for your home at retail stores, but they also have products available for facilities like schools and healthcare. So that's a great resource. And if you must use disinfectants as part of the Design for the Environment program, they have a list of safer disinfectants. And these products contain ingredients that have been reviewed for both human health and environmental safety. Environmental Working Group, they also have a really great resource looking at cleaners. You can look by ingredients, you can look by brand names. and they rate their the safety. It's like green, yellow, red, and green's the safest. Yellow's okay, and then red I would just stay clear of. So those are all some different great resources. And that's something that you can talk with the faculty about if they're creating lists for the school year of things for parents to bring in, so that they're bringing in safer products. And masks are really important. There's more and more research coming out about masks. A study just came out a couple months ago that really was reviewing what are some of the things that we can be doing that has the biggest impacts. And what they found was that cloth masks are helpful, but surgical masks are even better. That they can reduce the dissemination of viruses by shed by an infected wearer by up to 3 to 4 times, and even 100% in the case of seasonal coronaviruses, which is amazing. And when thinking back to that diagram with all the aerosols, when an infectious person wears a mask or face covering, the size of the plume is reduced. So it helps reduce exposure of those nearby, but also the whole classroom. So again, that masks are really important, and it's unfortunate it's become politicized because it is such an easy and great tool. An area that I'm really excited about, that I think nurses can have an amazing positive impact, is around school buses. There are currently about 500,000 school buses around the country, and 95% of them run on diesel fuel. And diesel fuel emissions, they contain higher levels of particulate matter, volatile organic compounds, other air pollutants that can cause negative health impacts. And about half of the nation's public school students ride a bus to school and back every day. So the potential for exposure is really significant. And when you think about the school buses idling around the schools, that air is getting polluted with diesel exhaust, and it can be coming into the school. So you're getting it, and it could negatively be impacting the indoor air quality. There's now, both within the infrastructure and Build Back Better budget, there's some provisions to electrify the school buses across the country. And there's also a lot of state level initiatives around this. Some of the states, like I'm here in Maryland, they're using the funds from the Volkswagen settlement to buy electric school buses. And estimates are that if we were able to shift all of the school buses in the country from diesel to electric, we would eliminate about 5.3 million tons of greenhouse gas emissions each year. So it could be a really great way for nurses to show leadership about air quality, addressing climate change, and the health of their students. And then I wanted to close with this really cool initiative that some college students have started. And, like I was saying, not all schools have the HVAC systems that are adequate to address the needs that we're facing with COVID-19. And so they've created these cool little filters that you can create. They take filters like you would use in your furnace. You make a box and you use a box fan to create these little mini filters that you can just put into a classroom, and they are extremely effective at filtering out COVID-19. And so I want to, if I can get it to work correctly, I'm going to show you all a short video talking about these this really cool and inexpensive invention to filter air that could be utilized in schools around the country. Stop.
An army of do-it-yourselfers at UC San Diego is thinking inside the box.
These are the instructions.
Building 250 homemade air purifiers for classrooms and labs around campus as an added layer of protection against COVID. 4 air filters make up the sides. As air flows in, an electric fan on top draws out the purified air.
The virus, if it's there, will get trapped in the filter material.
Professor Kim Prather says the box filters at least 90% of the particles that can carry the virus. And the box brigade is growing.
The filters make 4 walls.
From 9-year-old Kaylin in Hawaii to robots on the East Coast.
20 by 20 by 2 MERV 13 filters.
Jim Rosenthal, who helped design the box, knows a thing or two about air filters. His company makes them. Are you getting, forgive me, fan mail?
My fan mail is basically all the people who have adopted this project as their own.
Just put that down to cover that.
This one was the Letizia family's project.
And just do a big S.
With a custom design.
Beautiful.
Dr. John LaPook, CBS News, White Plains, New York.
Hey, that's well done.
Love that.
And it can be a great project that nurses or faculty can do with kids. You know, I can see in the science classroom making a few of those, doing some experiments with it. I think it's a great way to be teaching about air quality and, you know, making that health connection.
Can you drop that link in the chat, Katie?
Definitely.
Thank you.
So Laura, Dr. Anderko has been fielding calls throughout the pandemic from concerned parents and school nurses and health professionals around what to do in schools. And Laura, I was wondering if you could just tell us a little bit more about, you know, the questions you've been getting and, you know, kind of how you've been able to respond to them.
Yeah, be happy to. And there's a number of questions in the chat box too that we can entertain. But I'll give you a couple examples of, so the Mid-Atlantic Center is one of 10 centers throughout the US, funded through CDC and EPA, and we do outreach, education, and consultation. And so we'll receive emails and calls from parents, principals, teachers, around a variety of environmental exposures. And as you might imagine, last year and into this year, there have been a lot of questions and concerns from parents related to COVID. Last year at this time, you may recall that there was a lot of push towards disinfecting. You know, many of us, including myself, sprayed our groceries and let them sit for a while. And what they're finding is what Katie said, is it's really, you know, it's airborne. And so wearing a mask is pretty simple, pretty cheap. There's a variety of kinds of masks that we can wear that are more protective than others, but any kind of mask is better than no mask. And we have had calls from parents of children with chronic health disease, like heart condition, in states that do not require masks, do not require vaccinations for this year. And we work with those parents to help them know what their rights are, know if that child might qualify under a certain law called IDEA, and may request that their child is in a classroom with masks and with protections because of a health condition. Again, last year at this time, there were a lot of schools purchasing really expensive fogging equipment to kill the germs in the classroom on the fomite or the hard surfaces. And it took a lot of time and energy to educate administrators and parents that this is actually not only not helpful, but it's actually can be harmful to children. And Katie, one of the questions in the chat box had to do with IPM or integrated pest management. And as you mentioned, disinfectants are considered pesticides, and it can trigger asthma attacks. And so for kids to be bringing in their own Lysol wipes or to be spraying their desks and cleaning it up is really actually not healthy at all, and not recommended by health professionals. So as much as we think we need to have a perfectly clean environment, the reality is that this is airborne. And I love your example with the cigarette smoke, because we can all acknowledge that. And when you walk by somebody who's smoking, you kind of have that smell. Same sort of thing with any sort of virus that is airborne. We may, obviously, we're not going to see it, we're not going to smell it, but it's there. And so other questions and other concerns we've had really relate to air quality, which is what Katie spent a lot of her time on today, indoor air quality. We do refer parents to the schools, Tools for Schools, which has a wonderful app where you can go in and assess, organize, communicate, assess, and then create a plan. Every school, one of the difficult things about school systems is that they're run by local school boards, right? And there's a lot of misinformation, there's a lot of confusion, and there's a lot of lack of information about kids who are integrated within the school system, who have chronic illness, who are immunocompromised, who will feel the impacts should they get exposed to COVID. And so there's a lot of education going on, a lot of educating related to how to advocate for your children and how to present sort of the facts to school boards, such as bringing in those children who may have respiratory problems or may be in special education because of physical needs, and what those decisions might be as an impact. Indoor air quality, and I love this. I had not seen this before, and I've been immersed in sort of indoor air quality for several years. Had not seen the outside the box, think outside the box gizmo, which is quite good. And Katie mentioned that HVAC systems, as school systems are very different, even from one county or one community or one neighborhood to another, so are the HVAC systems. So as Katie mentioned, we will go through sort of the process of saying, well, to parents or teachers or school nurses, you need to first find out what sort of HVAC system you have. Can you bring more air quality or outside air in? And is that air quality any better, right? So if you're living in a state with high levels of pollution or wildfire smoke, you're not going to want to be drawing that air in. So lots of things to think about. New research is showing that HEPA filters can make a huge difference within a classroom. You don't want air filters that produce ozone, because that will trigger asthma attacks. But HEPA air filters are quite good at removing the COVID. They do have to be maintained, of course, filters changed, etc. Which is an option if it's a school that has an outdated HVAC system. I'm going to put my political hat on as well. And Katie had a slide about nursing advocacy. Education and advocacy go hand in hand. And oftentimes when we talk to parents, it's giving them, helping them find their voice with facts and giving them opportunities to share their concerns in certain venues, whether it's a school board meeting or whether it's a PTA meeting. to get their voices heard. It does make a difference. And school nurses as well, encouraging them to get involved, to talk to the school board about what the health impacts might be, what the hazards are. And you may or may not know, but the infrastructure bill that Biden is proposing has money in it to upgrade schools, including their HVAC systems. So when they start trimming, who knows what's going to be on the floor, the cutting floor, but you need to really encourage your senators and representatives to support this infrastructure bill as it stands, because there's a lot of good things in it to protect kids and their health, particularly within school settings. So I'm going to stop talking. I'm going to open it up for questions for Katie and I. We can certainly answer some of the questions on the chat box. I can tell you with school buses, I know that Fairfax County is converting their buses to electric. So there are mechanisms to do that without tossing out the school bus if you buy a brand new electric bus. The reality is that those buses will get purchased by others, whether they're churches or hippies who want to take a road trip. Those buses tend not to be, discarded. They tend to be sold to others, which continues to pollute the air. But there was a concern about where do those buses go. And integrated pest management is either at least reducing the use of pesticides and trying to eliminate it. And if you just look up IPM, EPA has a lot of information on IPM, and it's a safe way, instead of putting poisons down, or if you have ants in your kitchen, instead of spraying them with poison, there's lots of pretty simple, clean, natural ways to do that. And it does, many of these poisons will stay for decades in your home. They're very hard to get rid of once you spray them. And so, and particularly if you have people with respiratory or heart conditions, they can really trigger some pretty severe reactions depending on how much you use. So I'm going to open it up. Katie, I don't know if there was anything else you wanted to mention or ask me.
Oh, I'm just, one thing I was going to say about the pesticides, I'll drop a link in the chat. There's a really great website called Beyond Pesticides that has pest specific recommendations. So if you have ants, it goes from like the least toxic to more toxic, but not, like, they're definitely the safer side. And I've utilized their fact sheets myself. And, you have to be completely honest that sometimes it does take a little trial and error more than using some of the more toxic pesticides. But when you know that most pesticides work by damaging either reproductive or neurological systems, I think especially if you have kids in the house, making sure you're not using something that could damage one of those two major systems within the body, it's worth that little bit of trial and error.
Yeah, good point. I forgot about Beyond.
Katie, can you talk about reusing surgical masks and because of the waste of people just using surgical masks instead of cloth masks?
Yeah, and I'm not a expert on this, but I do think that there are now some brands coming out that are washable. So I would say trying to find washable surgical masks. I also know, and I don't know if the research is out there yet, but double masking, but that can be hard, especially for kids wearing two masks. And I would also say, think about, again, like, what is going on in your area? Is there a spike in cases? That might be the time where I'm like, yeah, I'm definitely wearing a surgical mask. But if the cases are pretty low, and you're doing lower risk activities, then I would say maybe that's the time to be using the reusable cloth masks. So I think doing kind of a risk benefit analysis.
I've also heard of people leaving their masks in the sun to kill some bacteria and viruses. If you do that, I wonder how many times do you think you can reuse that mask, especially if it's in the sun, it might be breaking down those.
Yeah, I haven't heard
Yeah.
anything about that. I do know with the cloth masks, if they're according to what's recommended, which is 2 layers with the little bridge on it, they're pretty effective. If they're a single layer, not as effective. And even some of the surgical masks have been tested at only 40%. Obviously the N95s are the best. But those, again, you don't really want to reuse over and over again. Although having said that, I know a lot of physicians and nurses in the hospital that had to reuse theirs when COVID first hit. It's not ideal at all, but any kind of mask is better than none. And I think because of the politics and kids hearing what mom and dad are saying in the TV, it's confusing to them. And it's really important that they understand that this is spread via air and that wearing that mask is going to protect other people as well as themselves. Yeah. There are a number of websites on masks. In fact, the New York Times did one maybe even a year ago now on the various kinds of masks and which ones are more effective, etc. I would say just a mask is better than nothing. And if it's reusable and washed every night, you're going to be okay. Kids are going to be okay. There's an article just in the Post today that compared to 70-year-old adults who have been double vaccinated, children who are masked are still at much less risk of getting COVID, even though they're not vaccinated. So, masking is key, and, washing hands and all those public healthy things that we like to think kids are being taught, preferably with soap and water and not Purell, but what can I say? Other questions?
Also, we'll send out in the email after this, we've been doing a couple different action alerts going out to Congress. And so we can send those out to folks. If you want to sign on, you can send letters to your senators and representatives around some of the things that we've been talking about today. And definitely make sure you mention you're a nurse.
Yeah, definitely. Really and truly, it does make a huge difference. There's a question, is there a concern for mask mouth syndrome and mask wearing? I have not seen any research. I've looked at this and have not seen anything that shows that there's concern at all for that.
And Julie's asking if we can share, if they can share the action alerts with other nurses. Yes, please. Yes. Please share far and wide. Right now, our voice.
Are you doing any action alerts for the infrastructure bill? Oh, good. All right.
Yeah. So
for everybody.
So we've got lots of opportunities to engage on this. And if any of you are interested in doing meetings with your legislators, we're doing meetings right now. We can give you some talking points or help you get connected to set up virtual meetings. I mean, as challenging as the pandemic has been, one of the best things that I think that's happened is how we're now having more access to our elected officials because of virtual meetings. So you're not having to drive to the closest office or come to DC. You can just set up a Zoom call, which is really awesome. And I'll put my email address in the chat here. If you're interested, just email me and we can start getting something set up for you.
Sounds good.
We're almost at the top of the hour. Any last questions? And thank you, Kathy, for posting about the Coalition for Healthier Schools. They've been real leaders in trying to get more funding for the EPA to help with indoor air quality. So that's a great point.
Katie, nurses may be able to find some talking points there as well on that website.
Good point, Kathy. Great. Well, thank you all so much for being with us today. And be on the lookout for an email with the post-test and evaluation. And just as a reminder, you need to fill that out in order to receive your 1 hour of continuing education credit. And have a great Children's Environmental Health Week.
Yeah, thank you so much, Dr. Huffling. We appreciate it. Bye,
Take care, everyone.
Bye-bye.